Good morning, everyone. I'm Kim Schreier, pediatrician and member of Congress from Washington State, and I want to thank all of you for being here today to bring attention to the importance and safety of vaccinations for children, for all of our communities, and really importantly, to call out the dangerous and irresponsible and, quite frankly, reckless rhetoric of the Health and Human Services Secretary nominee Robert F. Kennedy Jr. Both as a pediatrician and a member of Congress, the safety and well-being of children and families in our communities are always top of mind. Now, in the retrospectoscope, when I was sworn in 2019, there were measles outbreaks popping up across the country. In fact, the first thing I did as a member of Congress was something called the Vaccines Act to combat misinformation. Now, the reason for these outbreaks was a drop in patient-parent confidence and a drop in measles immunizations across the country. And this drop was due to misinformation, the exact kind of misinformation and conspiracies that were sowed by people like Robert F. Kennedy Jr. And it's beyond irresponsible. It is reckless. Those words are powerful. And because of those outbreaks, of course, the vast majority were people who were not already immunized. But you know what? Babies don't get this immunization until they're a year old. So babies who were too young to get immunized also got measles because parents chose to not immunize their own children. Kids ended up in hospitals. This is a serious disease that had nearly disappeared from the United States until people with no medical experience or justification began sowing doubt about vaccine safety and necessity, and some parents decided to forego the vaccines, and lo and behold, measles reappeared. It is one of the most contagious diseases out there. We just got through COVID. This is way more contagious than COVID. You could walk into a room where somebody with measles had been 2 hours prior, breathe that air, and get measles. I want to be really clear about this. So, and it exists in many other parts of the world, particularly where there is inadequate vaccination. And frankly, as soon as our immunization rates dropped here, it showed up here too. The Secretary of Health and Human Services, this is an important role. The role is to keep our country healthy. And I could not agree more. With exercise and healthy diet and removing pollutants and exercise and less screen time and more social engagement and a healthy environment. Don't smoke, don't vape, wear your helmet when you ride your bike, but get immunized, and certainly don't undermine public confidence in something so important. Immunizations were one of the greatest advances, actually started back in, I believe, the 18th century, but the most important advances were in the 20th century, and it has saved countless lives in the millions. Now, because of this misinformation and doubt, many worried parents would come and see me as a pediatrician, and I spent hours happily reassuring them, going over the data, talking about misinformation, how dangerous it is, and what the data actually shows. And frankly, sowing this doubt in the minds of parents and the citizens of this country should disqualify Robert Kennedy Jr. from this job. So we, physician members of Congress, nurse members of Congress, are here to let the incoming Trump administration and the Senate know that we believe RFK Jr. is not only unqualified for this role, but he would be dangerous to the nation and to the rest of the world that follows the lead of the United States. Trusting science is more important than ever now, and we will fight against misinformation and conspiracy theories and attempts to undermine scientific integrity. Now, I'd like to introduce, and I really have the privilege of introducing Dr. Josh Green, the governor of Hawaii. Just as a bit of background, he is the only current U.S. governor who is a physician. As the only governor physician, Dr. Green understands the importance of setting public health policy and its impacts on the lives and health of everyday people. But there's more. In 2019, in the middle of a major deadly measles outbreak, Dr. Green led a team of 75 medical professionals on an emergency mission to Samoa, where they successfully vaccinated 37,000 people. I'm going to hand it over to Governor Dr. Green to elaborate on that experience, why it happened, the importance of vaccines to saving lives, and the dangers of misinformation and disinformation spread by people like RFK Jr. Thank you.
You go. Yeah. Aloha, everyone. So thank you for that very kind introduction. I'm going to break it down a little bit. I was a family physician and have been an emergency room physician since then for my whole adult life. Went to Hawaii with the National Health Service to serve in rural Hawaii, where I ran a community health center and covered the ER for over 2 decades. I did ultimately get into government, served as lieutenant governor in the point of the COVID response in Hawaii. We had the lowest mortality in the country because we use science. And then I'm going to share this story about Samoa. But a physician, I'm really grateful to join nurses and physicians, scientists, okay? This is an absolute life or death decision that the Senate and the US Congress, and frankly, the incoming president is poised to make over RFK Jr. Now let's get right down to it. In 2019, a tragedy occurred. 2 individuals, two children died when they were vaccinated because of a human error. 2 nurses made a mistake. They put the wrong reagent in with the vaccine. There was nothing wrong with the vaccine, but they made a human error. In the aftermath, Samoa, which is very close to Hawaii, we have 40,000 Samoan citizens that live and spend time in Hawaii. So it's very important to us, me as governor and physician. We saw what was happening in Samoa. They started to lose confidence in their vaccine program. A celebrity with no public health experience named Robert F. Kennedy Jr. went to Samoa, met with the Prime Minister, met with the Secretary of Health as they were reeling from that tragic accident, and he cast doubt. He cast doubt on their vaccination program. So he crashed because of his celebrity status as he traveled with his spouse in Samoa, a place where he is not a social worker or a pediatrician or family doc or nurse. He went and discouraged them in partnership with his not-for-profit. He discouraged them from vaccinating. And what happens when you discourage individuals from vaccinating when they're afraid? A lot of them refuse to get vaccinated. The health department gets nervous. They are bombarded by misinformation. We are all aware of what social media can do. So again, as a celebrity non-healthcare provider, he went into that country and scared them. Their vaccine rates crashed to 31%. When you get anywhere under 90 to 95% in a society, as the good pediatrician just shared with you on measles, mumps, rubella, it spreads like wildfire. So at 31%, he doomed them to massive spread. I called the Minister of Health in early December 4th, I believe, of 2019. I said, we can come with a couple volunteers and help with some additional vaccine support if it would help you. She immediately consulted with the Prime Minister, and they humbly asked us to bring an entire medical team. And 3 days later, we arrived with a team of 75 healthcare professionals and joined their team of 300 healthcare providers, assistants, and so on, to fan out across Samoa and vaccinate the country. But it was too late. Because of Robert F. Kennedy Jr.'s essentially attack on their public health system, already 83 people had died, most of whom were children. Already there were 5,000 confirmed cases of measles. And this is no joke when you see pictures of a child with measles when there are no hospitals around, when there are no ventilators around to keep them alive. When people get these viruses, they may sometimes survive, but they suffer encephalopathy, which is infection that causes inflammation in the nervous system. That can cause deafness or blindness or intellectual disability. So there are thousands and thousands of other children and adults in Samoa that have now suffered terrible consequences, not as bad as dying, which we witnessed a child literally die in front of us. Just moments as we came into the village, a child passed away from measles, and she was still warm when I put my hands on her face. Put my stethoscope to her chest, no heartbeat, no breathing. We had a brief memorial ceremony for that beautiful child, and then we left the house, and we went and vaccinated all of her siblings and her relatives, and then we went to the next village and the next village. And this would not have been necessary if not for an interloper named Robert F. Kennedy Jr. And here's the rub. Measles stopped a week after we did the vaccination program. It shows you can do the right things in public health. And we may not agree on all public health issues, of course, but the foundational ones have to be in the wheelhouse of the next HHS secretary. Because if they're not, and he already has responded to our complaints and attacks, he's already responded with his excuse. He won't take anyone's vaccines away. He will discourage them, or he'll have them investigate. And what does that mean in this modern age of social media? It means that millions and millions of people who are on the bubble, which we just saw with COVID and we saw with the outbreaks that were referenced before, they will not get vaccinated or they will delay. And children who are vulnerable will catch disease. Adults who have compromised immune systems, who may be on chemotherapy, might have renal disease. They themselves will also be vulnerable. Many people do not have natural immunity and immune systems that are up to par any longer. They will also be vulnerable. I will say this, President Trump, respectfully, please rethink this nomination. There may be a very good place for Robert F. Kennedy Jr., perhaps in the environmental divisions of your government. This is not partisan. This is not political. This is medical. Find a place for those kind of individuals elsewhere, because whatever individual you put into HHS to run it has to believe in science, has to take these absurd biases away. Otherwise, you will be condemning America's children to disease and fatalities. And we healthcare providers will have to do all we can to clean up after that disaster. So please don't do it. That was my experience in Samoa firsthand. He should be put to the question by the Senate. He should have to be accountable for his comments, his social media posts, what he was doing in Samoa. If we're just being real people, it's obvious. He was torpedoing and taking advantage of vulnerable people. And that can't be allowed in someone who would lead our public health system. So I would humbly ask that they rethink that appointment, move on, and give us someone who's going to fight for our children. And with that, if I may, I would like to introduce Congressman Ami Bera, who is a distinguished physician, who has fought for legislation that helps us deal with complex disease states and disorders, who represents his constituency in California admirably. And it is great for me as a physician governor to see physician leaders in the House and Senate. I am so grateful that you're here.
Thank you, Gavin.
Thank you.
So, as Dr. Schreier, as our governor has pointed out, the science around vaccines is clear. The safety and efficacy of vaccines is incredibly clear. You know, we've been on the front lines in California and Sacramento fighting some of this fight, but the vaccine hesitancy was really on the fringe. Imagine what happens if the top public health official in this country amplifies vaccine hesitancy. We've seen it post-COVID, but if the top public health official amplifies vaccine hesitancy, people are going to die. And that'll be on him. That'll be on President Trump when they die. The most impressive medical feat in the history of the world was eradication of smallpox. This is a disease that killed hundreds of thousands, if not millions of folks pre the 1970s. Through concerted effort, public health, vaccinations, etc., we've eradicated smallpox. We know what we can do with vaccines. We're close to eradicating polio. We were close, you had small outbreaks in the United States of measles, but we, for the most part, eradicated measles here. So imagine if the top public health official in the leading country in the world were to come out and say, well, we don't know about vaccines. This is a dangerous nominee. This is a dangerous pick, and we need to be very careful here. I urge the Senate to reject this nomination, and I urge President Trump to rethink this nomination. As the governor said, Maybe there's a different place for RFK Jr., but leave it to the scientists and the doctors and the nurses and the healthcare professionals to make the decisions about the best medical care necessary. We don't need politicians making those decisions. And with that, let me introduce my colleague who is a tireless champion, the only nurse, only Democratic nurse in Congress. But I've seen her out there on the front lines advocating for access to healthcare, sound science. You know, we saw it through the pandemic, and she's a tireless champion. Lauren Underwood from Illinois.
Thank you. Well, good morning, everyone. Thanks for joining us. I'm Lauren Underwood. I'm a registered nurse, and I'm so glad to be joined with my colleagues here in the House, 3 physicians who've dedicated their lives to public health, and Governor Josh Green, another physician who has done the same. Thank you, Chauncey from 314 Action, for bringing us together to help save kids' lives. Because Republicans have made it clear, over the next 4 years, attacks on our health care will be priority number 1. From repealing the Affordable Care Act to attacks on critical life-saving vaccines, from their own policies to their nominees, the plans are out in the open. So we're here today to fight back, fighting for data-driven, science-backed healthcare that saves lives and keeps us all healthy. In the height of flu season, friends, and on the heels of COVID-19 pandemic, at a time when routine childhood vaccines are declining, we must move forward, not backwards. My colleagues have made clear the data shows that vaccines work. History shows that vaccines work. But now's the time that we should be investing in our communities to help them increase their immunization rates and to keep our children and our families and our seniors and our communities safe and protected. Now is the time to fund the agencies doing world-class research and protecting public health. Now is the time to make sure that our federal workforce, like our Border Patrol and Customs officers, are fully vaccinated and protected on the job. And now is the time for the Congress to pass the Omnibus, which includes legislation that would improve maternal vaccination rates and reduce the vaccination disparities that are putting our moms and babies at risk. I was first elected to Congress in 2018 with Dr. Schreier. And at the end of my first term, the pandemic was in full swing. I spent much of my second term fighting tooth and nail to make sure that my community had everything needed to stay safe and healthy, because Donald Trump's administration turned a crisis into a catastrophe. We know this playbook, and we will not allow it to happen again. So thank you for being here, and I am so delighted to welcome our new colleague, Dr. Herb Conaway from New Jersey.
Thank you, and I am certainly very pleased to be joined by so many distinguished professionals fighting for public health. I am recently off of a public health billet because I served as the director of the health department in my county. Nothing like timing. I arrived there just before the pandemic, and I can tell you what a difficult challenge that was for our country. But in reflecting on that experience, I came to understand even more greatly just how important public health response is, and that we need to use all the science-based tools that we can deploy to deal with the challenges that impact public health. And certainly, one of the important tools in our armamentarium are vaccines. We very quickly moved, as soon as they were developed, to get them out. We had one of the largest vaccination efforts in the state. And we protected our population and prevented those, particularly the vulnerable, but who either had an immune system difficulty, or they were under cancer chemotherapy, or they were up in years, or they had smoked or had or diabetes, other healthcare challenges. Getting those vaccines into the arms of those individuals saved lives. And we know when the former Trump administration ignored this problem, talked about junk science, gave advice that was pulled out of thin air, that people followed that advice to their detriment. And many people lost their lives who otherwise would have been saved from this pandemic, but for the misinformation they received from the highest levels. And there's the danger with Mr. Kennedy, who came to New Jersey. Now, as I've been fighting to deal with trying to make sure that we increased vaccination rates, kept them high. We saw measles outbreaks, as we saw through as a result of his efforts and the misinformation that pervades the internet. Vaccine rates come down, and as they come down, as you've heard, the rate of disease infections that are all but eradicated begin to come back. We've seen this. We know how this works. And I would submit to you that we, and knowing this, need to avoid it. One of the biggest challenges we have in public health today is this issue of misinformation, so pervasive on the internet. And unfortunately, many people don't understand how to evaluate the information that comes to them. Is this information coming from a trusted source? Now, people should expect that one of their trusted sources should be the leader of the Department of Human Services that's responsible for public health. But now we have a person, a nominee, who has shown through his actions that he is willing to deal in misinformation, I guess for his own self-aggrandizement, for money, for fame, who knows. But there are people in the society who do this because they just don't like vaccines, because they just want to take a toss it up in the air approach to decision making, and that's dangerous in the healthcare context because there might be serious illness or death at the end of that kind of decision making. So we know that vaccines are effective. We know that the risks of using vaccines are extremely low, less risky than many activities that people engage in. And one of our problems we face in public health is that people haven't seen the polio ravaging through their community. They haven't seen deaths from measles because we've taken responsible action to end the scourges of mankind, whether it be smallpox, which killed 30% of the people that it infected. We've removed that threat from the population. Measles, highly contagious and deadly. Flu, highly contagious and deadly to many. And so we have a responsibility here. And one of the things I hope our Senate does, and what we as a co-equal branch of this government, we need to push back and using our constitutional responsibility to say no when we can see by history that we're getting off the rails with respect to public health. So let's hope our senators who have a direct responsibility here hold these nominees, and particularly Mr. Kennedy as a nominee to HHS, accountable for his actions, for his words. Let the American people look at what he said and done, and vote to support public health and to make sure that the next vaccine to deal with issues that are here and now and may be emergent can be developed in a timely way to save lives. He says he's going to leave the current vaccine program alone, but he'll have a decision about whether or not new vaccines can go forward and be studied and researched and be brought to the market. That's a very important power he has, and a very dangerous one, in my view, if his decision making is not grounded firmly in science where it needs to be. So with that, I'll thank you for coming, and let me engage in a great honor, and that is to introduce Shaughnessy Norton. She is the president and founder of 314 Action. It's named after the first three digits of pi, if you haven't already caught that. This organization mobilizes scientists, particularly in healthcare, but right across the science space, to get off the sidelines and engage in public policy, and particularly here today in public health issues. Shaughnessy.
Thank you. Thank you all for being here, and thank you, Governor Green and Congresspeople, for your leadership in making sure the American people here know what a danger JFK Jr. poses as Secretary of Health and Human Services. The tragedy of what happened in Samoa when RFK Jr. Used his platform to misinterpret and mislead people into not vaccinating their children, and the preventable deaths that ensued is one. It's a tragedy, and it's a story that the American people and the senators that represent them need to know. I am Shaughnessy Norton. I'm the founder of 314 Action. We work to mobilize and engage the public or scientists on public health issues where evidence-based information is needed to make informed decisions that keep people safe. And frankly, childhood vaccination programs, as these healthcare providers attested to and decades of data has shown, are effective and safe and necessary for preventing deaths. RFK Jr. has a well-documented history of rejecting the expertise of those that have spent their lives working in public health, instead clinging to and promoting fringe theories and beliefs and conspiracy theories with life and death consequences. This should be a disqualifier for the person tasked with leading the nation's top health agency. It's a good thing that scientists don't conduct their studies as recklessly as JFK Jr. handles the truth. The tragedy that befell Samoa did not need to happen. It shouldn't have happened. And this is what JFK Jr. was able to accomplish with just his celebrity status. Think about the consequences of what a Senate approved confirmed power would give him. So I join the members here in calling for a rejection of his nomination as secretary. It's also why we've launched an ad program, TV and digital, to help get this story out to the American people, the senators and their staff, to help prevent this confirmation. Thank you.
Thanks, everybody. Appreciate it.